Hello.
Well, hi there, doctor. How are you?
Down. Great.
Hey, how
Fantastic.
should we address you during this interview?
I guess Dr.
Okay,
Ayala.
cool.
Now that I'm
So we just wanted to send out the invitation early because we had a little bit of trouble last time. We'll plan to get started like right around 7 o'clock, okay?
Just to make sure,
good.
Dr. Ayala. Okay, I want to make sure.
Ayala. Yep.
Thank you so much for being here with us. We really appreciate your time.
Yeah, 100%. This is so fun.
Were you in AWS before your fellowship or during med school?
Yeah, as a medical student, like a million years ago. I think it was kind of just starting out, I think. And not a lot of people from our school were free. I went to a bunch of events. We had really good mixers around the country. I don't think social media was really as big as
That's
it
true.
was. It was all Facebook back then. I'm not that old, but I feel old with how social media
That's
has moved
okay.
so quickly.
Yeah, I just recently had to make an Instagram because like nobody uses Facebook anymore. And honestly, I didn't realize that because I'm just behind.
Facebook is great for groups. A lot of really great groups.
Do you guys do anything fun this weekend?
This is embarrassing, but I was totally watching Grey's Anatomy.
No, yeah, my fiance is watching the newer seasons. It's just completely different, you know. I actually kind of like the newer seasons. I think that they're, I mean, just as dramatic, but a little bit more sentimental, I guess.
Got it. That's funny. One of my patients told me that I should start watching it, and I'm like on season 2.
Yeah, they
It's ridiculous.
throw out all the old cast, all new cast, but with some relations. So
Got it.
oh
Seasons, right?
my
That's
god, yeah.
2 decades.
But if you like Grays, Amsterdam's pretty good. It's just a little less drama, a little less like a more deeper message, I guess. If you have time. If you
Yeah.
have time.
Not really. Like other things, but that's funny. I wrote a paper when I was in residency about Grey's Anatomy. If plastic surgery is portrayed properly, like some like silly title like I've seen on TV. But I'm very lucky that I had really great medical students who watched all of the show and pulled out all the plastic surgery from it.
So what was the conclusion? Is it accurate or no?
It's sort of accurate. I mean, it's actually more accurate than you think. But there's just things that they have to dramatize, like putting an ear back on, and the next day they ran on the patient, and it's like totally healed. Right? That doesn't make sense.
That's fair.
Did you ever see that one? It's called like Nip Tuck, and it's about 2 plastic surgeons.
I think that was like
I don't know.
way before
I don't
Grey's
know. I
Anatomy.
only watched a couple of those, but yeah, very dramatic.
To everyone here, we're about to start in about 3 minutes. Just hang out here and we will let you know.
Hey Amber, is my internet like working okay? Am I breaking up at all, or is it coming through all right?
It's okay. At times you are breaking in and out. But I'll let you know if we can't hear you or if you need to repeat a question. So.
Okay. Yeah, I'm staying at my friend's house right now during this audition.
Mm.
Yeah, I don't know how the
Where
internet is.
are you right now? Or I mean, like location-wise, at least.
In the Detroit area.
Okay, it's not bad. Mm-hmm. Dr. Aiello, out of curiosity, what do you recommend? Do you recommend clogs or compression socks? Because Sarah wears clogs, and I'm just curious.
I do socks. I work for an Italian-based
Oh,
company. For their wage when I was in residency, they're honestly the most
yeah.
holes. So there's like,
Do they have their own website, or is it like you can buy via Amazon kind of deal? Yeah.
I usually buy through their website because they're not that expensive. I've had the same pair
Oh,
since
what are they called
my
again?
intern year. Zeros. I think a lot of people have them. They're the ones that have, you can either get them with holes on the top or not. I recommend the holes on the top for obvious reasons, but there is ventilation on the sides and they come with crazy.
I can deal.
It's good. And obviously it lasts forever. So actually, I have two pairs now. I have my blue pair is my original pair, and I use that for all my non-breast cancer cases. Then I have a hot pink pair that I wear.
I like.
See me from like a mile away. I mean, you can see me from across the hospital. There.
I see.
They get a kick.
Okay, so it's 7 o'clock. I think we can go ahead and get started. Thank you everybody who's joined us on this lovely first Monday of August. Here at AWS, every first Monday of the month, we host an Instagram live interview as part of our surgical subspecialty series. And today we're talking all about plastic surgery. Today we're joined by Dr. Ayyala, who's a plastic surgeon, and she'll be telling us all about her journey. If you have any questions, you can just drop them in the chat and we'll try and answer them at the end of the interview. So I think we can just start out with some introductions. I'm Sarah Campbell. I'm a fourth-year medical student at MSU Com and a member of the AWS Instagram subcommittee. And then I'll pass it off to my colleague, Amber.
Hi, I'm Amber Park, and I'm a current third year at LMU DCOM. And if Dr. Ayyala wants to introduce herself.
Sure. So I'm Hari. I'm a professor of plastic surgery at
Yeah, go for it.
Sure. So I'm originally from New York. I went down to DC for school at George Washington, and I stayed there for college and for med school. Went straight through, started making my way back up the East Coast. So I did my integrated training in plastic surgery at Rutgers in New Jersey, and then up in my fellowship north, and now I'm in New Haven.
You go, sir.
Sorry, I just froze for a second. So Dr. Ayyala, thank you for that introduction. Would you be able to tell us a little bit about your journey prior to pursuing plastic surgery?
Sure. Yeah. So, like I said, I kind of went straight through. When I think I've always kind of either wanted to be a surgeon or an architect, and knew I wanted to be a doctor. Knew I wanted to be something hands-on, and it was kind of easy to marry surgery and architecture with plastic surgery. Kind of an architect of the body. I didn't really fully realize the breadth of the diversity of the specialty. We didn't have a plastic surgery program when I went to medical school, so it was kind of hard to figure out this is what I wanted. And actually, as a first-year student, I just Googled medical student surgery travel grant. And I went on travel grants to conferences to explore the different specialties. And I finally ended up at the microsurgery conference for plastics. And
that's incredible. So that's how you kind of got introduced to plastic surgery, just through like going to conferences.
Yeah, it was great. I highly recommend it. I mean, you network and you meet people and you really see how they live their lives and how passionate they are about their work. So I went to like an orthopedic conference and a general surgery conference and a vascular conference. And then finally, when I went to the micro conference, you're just walking down the exhibit. And then there's, you know, like teeth. It was just so varied and diverse, and it was pretty amazing that you can do so many things in one specialty. And obviously, you know, as I went through my sub-Is and things, you realize you can do anything. You operate on kids or adults, trauma or cancer, like every part of the body, every type of tissue. It's
So
really
you
amazing.
mentioned that you specialize in microsurgery. Can you tell us a little bit about what that means?
Yeah, so microsurgery is small vessels that you connect together, and it's really about moving tissue from one area of the body to another. If you are missing tissue, you ideally want to replace that with the same type of tissue. So let's say I do a lot of breast. If you're missing your breast, there's no other place that you can really get breast tissue from. But you know, breast tissue is mostly skin, soft tissue, fat, things like that. And so we can utilize extra tissue from somewhere else, like the belly or the butt or the thighs, and we can shape that and create breasts out of that. Or if you are missing, let's say someone has cancer in their leg and they're missing let's say they're missing their quadriceps muscles. The goal is to not just restore muscle and bulk and tissue, but you want them to move their leg again. So I actually did this case in residency. It was great. We transferred, you know, a muscle from the back, and we keep the blood supply. So blood supply comes back together again. We can also hook up the nerves, and you can eventually have a fully functioning, you know, anterior compartment.
Wow. So
It's
you
great.
work with like a lot of different areas of the body, different tissues. It's like a pretty broad field.
Yeah, it's definitely a comprehensive skill set. I think microsurgery is, again, you're working with every area of the body, every type of tissue, and it's good creative problem solving, figuring out, okay, this is what is missing, what can I get to make this look, feel, or function the same way.
So we want to ask why specifically oncology, since plastics is so broad.
Yeah, and I mentioned, I like being a part of a team, and with cancer, you're really a huge part of a very multidisciplinary team. They're very complex problems, and cancer is super, super devastating for patients, but this is an opportunity that you can get together with like-minded, intelligent people and plan very carefully this operation that can not just eradicate their tumor, but, you know, give them some semblance of their life back.
And then we had some questions regarding like your journey towards getting accepted into plastics. So this is for all the medical students that are listening, you know, like us. What are some things you did in medical school, like besides the conferences you went to and probably networked a lot at? What are some things you did to make yourself a really good candidate?
So honestly, reading the applications now, I don't know how I made it. I barely scraped by. Like I said, I didn't have a program, so I didn't even know what you were supposed to do. I would say that I reached out to every single person that I could possibly think of that had even the slightest semblance of knowing anyone in plastic surgery. So everybody who had matched from my medical school previously, all of like their friends, random attendings that I had, and fellows that I had met at that conference, I emailed them all cold. People in general surgery that maybe knew someone that they either trained with or went to med school with in plastics, I emailed all of them and said, how do I do this? And it said, do research. And I was like, okay, there's no research opportunities here. And I realized kind of like, it was a little bit late. It was like midway through my third year. So I wasn't going to take a year off. But I think what I did was I networked. I went to all the conferences I possibly could in plastic surgery after that. I tried to present whatever research I was doing, and I did a lot of sub-Is. And that was valuable advice. Obviously, things were a little bit different during COVID, and I think it's, again, back to what it was, where people can do sub-Is. But making connections on the sub-I and really crushing it, getting good letters, those are the more important things.
What are some important things that a medical student can do to really like crush their sub-I, in your opinion?
Be very available, be very prepared. I can't say that I did the best job on my sub-Is, and in hindsight, like cringing thinking about how I was, but some of the best sub-Is, they are super easy to get along with. You can tell that they read not just for the cases that they're assigned to, but things change very rapidly. If you get the case schedule a week in advance and you have all the cases and you know which cases you're going to, and I say this for the residents too, you shouldn't just read for the cases that you're assigned to, read for the other cases too, because you never know if you're going to be pulled to a different case and totally different questions. Available and ready. Come on, like, don't be on time, always be early and be willing to stay late. Sub-Is who come and check on all the rooms, check on all the residents after clinic, they don't just go home, they go back to the workroom, they check in with the team and see how they can help out, not just to they're there, but to really help out the team. I mean, residency is hard. The residents are there all the time, and to have a sub-I that's like, hey, like, I got this dressing change and I've already prepped all of these notes for you, or I've already done all of this legwork to make your life easier. It means that they're not just interested in furthering their own education, but helping the team and contributing to patient care.
That's really good advice, and it's really important right now for a lot of us currently on audition. So thank you for those tips.
We really like the way that you phrase that, focusing on helping the team versus trying to make yourself look better. I think a lot of people don't realize that it's not just their performance, but their way to enhance the team. So I really like the way you phrase that. But now that you're on the other side of things, what would you say is, your typical range of surgeries and procedures that you do now?
Yes, I mostly focus on cancer. Most of that is breast reconstruction, because that is where, most of the cancer happens, unfortunately. But so in breast, I do both implant-based and autologous reconstruction. Autologous is that microsurgery where we're taking tissue from other parts of the body and moving that up to become breasts. Along with that, lymphatic reconstruction. So people who have, axillary or pelvic dissections, I do immediate lymphatic reconstruction for. I do a fair amount of abdominal wall reconstruction, and that's either cancer or not, and extremity, really everywhere. It's very fun.
Out of curiosity, I'm looking into flaps. So do you guys use like flaps as autologous tissue to replace like breast or anywhere else that has cancer? Or what specifically? Okay.
Yeah, so a flap of tissue that carries its own blood supply, right? Which is, so yes, the tissue that we're transferring is a flap of tissue that we disconnect from the body and basically auto-transplant somewhere else.
And then I think you already touched on this, but in your opinion, what are some of the most like rewarding aspects of being a plastic surgeon?
Yeah, I love my job. I love that I can work with, again, a very multidisciplinary team. So I get to hang out with other surgeons all day long. Part of being a cancer reconstructive surgeon is there's always another surgeon, right? There's always an oncologic reconstructive surgeon, and hang out in the OR and play good music and take really good care of patients. And again, like, we are in this journey together from pre-intra and post-op. And I think being a plastic surgeon means that you can always get to yes. So other surgeons call you when they need something, or they feel like it's the end of the line for them and they're not sure what the next step is. And it's really gratifying to always say yes, right? Like, Can I help you? Yes. Can I fix that? Yes, I will figure out a way how, because what residency and training teaches you is, again, this toolbox that you have, and you can figure out a way to get to yes.
Cool.
Well, I mean, so you say you touch about like the good parts about it. So I guess would you say the harder parts about being a plastic surgeon?
There are no hard
wish.
Just kidding. That's really tough. I think it's obviously a long journey to get here. So, training is long, but honestly, it's long for any surgeon, right? I mean, this is 6 years of integrated. Potentially, you're doing 5 years of general surgery, or 2 more years of research, and then 3 years of fellowship or independent, and then maybe another year of fellowship. So yeah, it's a really long road, but it's the best job. It's also, it is, yeah, I'm telling you as a resident, the best way to move forward is, yeah, you should always be available, and you should always be saying yes, and that can be very hard, because you're the reconstructive surgeon, so sometimes if you're waiting around all day for other surgeons to finish, then yeah, sometimes you're operating late, and that can be difficult to arrange, life and things like that. But on the flip side, I think you can really choose what you want to do. So, I mean, I choose to be a part of the cancer world, and I don't mind, waiting for other surgeons to finish so that I can start. You can do recon, you can do trauma call, you can work in an academic setting, you can work in private practice, you can work by yourself, you can take no call, you can work 9 to 3 Monday and Tuesday, and like golf or go drink wine the rest. I mean, you can do whatever you want. So it's very flexible, and it's good. We're people. Everyone should.
And out of curiosity, I guess, how do you balance your work-life balance with everything? You don't. It's okay.
It's hard because right now you started as faculty last September. I love to operate. I like being in the OR. I don't see time pass when I'm there. So I think that for now, my work-life balance is that I like working. I like being at work and doing all that, and doing research and being involved with residency. I think in the future, as I get a lot busier clinically, and now I'm realizing, what I want to do with research and education and balancing all of that, it is a very big learning curve, because I don't think I ever realized in training how much else you have to do. And so now I'm working with, I have a really good office staff, and, I have really good support staff. And so realizing what I can delegate clinically and administrative wise, that has been a learning curve. So all of that. And then really blocking off my time. So making sure that I'm really like maximizing operating in certain blocks, and then also giving a lot of time for myself and my family, because burnout is real, and you can love your job forever, but it's not sustainable, for decades. And things are changing in terms of like, you can have it all. I feel like I do, right? I feel like I can operate as much as I want, and I can do the research and the education because I have wonderful residents and a team and great colleagues and great office and a great boss. And I have a really supportive spouse who completely understands what I do, and it's totally different.
How do you personally deal with burnout?
You have to have people you can talk to that understand. So like I said, I'm married. I met my wife in residency. She was also a plastic surgery resident. She ended up leaving residency and now is on the corporate side of things. But it's nice to talk to someone who like literally understands what I went through in residency, what I went through in fellowship, understands why I'm at the hospital at 2 o'clock in the morning, and, doesn't even like question it, right? And then it's just super, super supportive. So again, it's not sustainable to do that forever, but you have to have someone who recognizes burnout in you and kind of like intervenes. And then you recognize also what is important to you, right? Like, at some point there's a really great book. It's called Essentialism. There's 3 things. So if I can remember, you have to realize does whatever someone is asking you to do, does it align with your passion? And does it, like, can you feasibly do this? Like, does it tap into your talents? Yes or no? Does it align with your passion? Yes or no? And then does it meet a need in the world? Yes or no? And unless the answer to that, all of those 3 things is yes, then maybe you should rethink that. So you can't do everything. And that is how people burn out. And so you kind of have to boil it down to what's essential for you.
What book is that called again?
It's called Essentialism. There's a sequel, and I bought both of them, but I haven't read the second one because I haven't had time.
That's completely okay. We understand. So, I guess along your journey, then, have you had any particular role models, mentors that have greatly influenced you? And if so, can you tell us about how you acquired this relationship and how you've continued it?
Yeah, I have awesome mentors from training. I think they're all a little bit different. And you can have a lot of mentors. I think that I had every attending that I worked with, every faculty and maybe senior resident was a good mentor because they show you different techniques and how they lead their practice and how they operate and tips and tricks. Thing that I gained from training were sponsors. And so a mentor can teach you, and you can have a lot of mentors, but you really want a couple of sponsors too. And there were 3 or 4 people that put their career ahead of theirs or on par with theirs, and they went out of their way to make sure that I would get ahead in my own career. So those are people who, reached out to fellowships that I was applying to without me asking and saying, hey, she's great, you should take her. Or when I applied for my job, someone from training reached out without me asking and said, hey, you should take her. And I learned that later, and it's kind of awkward. Or, just knowing that I wanted to be more part of academic committees and having, my fellowship director and my program director reach out to people and say, hey, she'll work hard, she'll contribute, and you should consider this person. That was invaluable. I think the most important thing, going back to what's important in residency and for a medical student to succeed, you really need someone to vouch for you, in the match. You want someone to pick up the phone and say, this person's amazing.
So you mentioned that most of these people you worked with, do you have any recommendations for during medical school? You did mention that you reached out to a bunch of people, emailed out, met people at conferences. So I guess whenever you're going to these conferences, out, what are you saying or asking to continue these and build them?
Yeah, so I think I didn't do it the right way, but looking at it now, people who come up to me, I really admire them. There's medical students who I've never met who said, hey, I am really interested in plastic surgery. I know that you are, at Yale. Can I come out there and shadow you, or can I get involved in your research? And then they'll give me a card, which is amazing. Someone gave me a card that had a QR code on it and linked to her website, and I was like, this is impressive, right? And then they will follow up, right? So you have to keep that mentor-mentee relationship. It's really hard to start from scratch, right? Like, I don't know you, you don't know me. We meet at a meeting, we all forget about it, because we meet 1,000 people. And then the medical students that email me afterward and say, hey, this is great. I either saw your talk, or I remember, like, this is the conversation we had. This is me following up. And then you start a relationship. And so I've actually had a bunch of medical students that I've met at random meetings, and we've had Zoom meetings, and we, check in every so often, or we do a project together. And that's how you form a relationship. Tell you, now the applicants are incredible. If I put my application next to theirs, there's like 0%.
Yeah.
Do you think it's getting more and more competitive?
Yeah, I think it's unfortunate that it's such a race that now there's all these statistics on like how many publications you need and how many research experiences, and it really just, I can talk about this for hours, but like really drives the disparities, because people who don't have the resources are always going to have less, and the people who have tons of resources are always going to have more. And if we only put our hat on numbers, then, that's not really fair. And so now we're move to this whole holistic approach, which is super important.
I guess, do you have any like advice or like anything you want to impart on a medical student who's pursuing plastics?
Don't. Yeah, honestly, it was hard, and I think some discouraged by, again, like the numbers and the statistics of the match rate. There's surgery, and even if you have, step scores or letters or research numbers or whatever statistics that you think is less than, there's always a way to match plastics. You can either go integrated, you can go through general surgery. Where there's a will, there's a way.
So I'm looking through the comments, and one question, someone had actually re-asked about what socks you used. Sorry.
They're not socks, they're shoes. I don't even know what they're made out of. I don't know, rubber, but they're Calzuros. Calzuro.
CALCA. Sorry.
CALZURO. Calzuro. Man,
for those who want to. But I think outside of that, we don't have any questions. Someone did comment, you can have it all. We really love that idea. But other than that, there are no other questions on our side. Do you have any questions for us or any other tidbits of wisdom you'd like to share with everyone?
Yeah, am I going to see your application for plastic surgery?
That's a hard one. Kind of stuck on ortho, sorry. Yeah.
Oh, no, I'm sorry. That's okay.
I just
have it. Oh, the beauty.
Yeah.
Go into.
I might switch. You never know. So.
I think the first person, whoever was like really encouraging to me and like, hey, you can do this. Like, you're doing a good job so far. Keep going. She was a plastic surgeon, and she was also the first female surgeon I ever worked with. So it does have a special place in my heart, but I think I'm more of like a gallbladder girl myself.
Oh my God. There is still time to change your mind.
We actually do have one more question that I skipped over. Do you have any tips for like our first year residents, interns, or fellows in plastic surgery?
Ooh. Measure twice and cut once. I know that's an adage, but you really want to be the surgeon that you want operating on your own family. So whenever you stay up late or you're like burnt out, or just remember why you're doing this. You're doing it for you, yes, but you're really doing it for your patients, because you want to be the best surgeon you can be. You want people to say, I want my family being operated on by that person. And then what else? I mean, my mission statement is like nothing less, right? You should give nothing less to your patients, but also to yourself and your family. Lead by example.
Some people are asking if they are able to get your contact information. If you are okay with it, would you want us just to type it down in the chat or let them know? It's up to you. Perfect.
Yeah, you can get my email out. It's just my last name at Yale.edu, but it's my whole first name. So there's a lot of these.
Let me type that out. But otherwise, I think that is all the questions we have at the moment. So we do want to say thank you so much for coming. We loved your story, super inspiring. Loved your humor, big fan. But thank you so much again for your time, and thank you to everyone who showed up today. So I'm about to type her email, but if you guys have any other questions, please send us a DM or shout us out. So thank you again. Doctor.
Next month will be rural surgery. So if you're interested in rural surgery, if you are a rural surgeon and like to share your story, just send us a message. Let us know.
Awesome. And Dr. Ayyala, you're free to leave whenever. I'm just letting people see the email for a little bit. So
yeah, thank you so much for your time. We really appreciate it.
Yeah.
there.